Good afternoon. My name is Heather Glasser, and I am part of the Psychiatric Mental Health Nurse Practitioner program at Briarcliff University. I will be conducting my oral portion of my project today and discussing transition from cage to audit in the outpatient psychiatric clinic setting, a quality improvement project. During this, I will be discussing the background, significance, stakeholders of the project, the PICOT question, supporting evidence, evidence-based practice model, project design and implementation, the results of the project, clinical implications and recommendations, and the nursing theory that was part of my project. For background and significance and the stakeholders, a literary review had been conducted to determine the expected benefit of utilizing the audit questionnaire in place of the cage questionnaire in an adult primary care setting. Alcohol use disorder is a common disorder in the United States. The audit is more of a detailed question compared to the cage questionnaire. Stakeholders may include organizations such as the Quality Control Board, Leadership Board, providers, the scribes, administration, office staff, and the patients and their families. The PICOT question chosen for this project was in adult patients in an outpatient mental health clinic. Does using audit at each provider visit detect more high-risk alcohol use behaviors within an 8-week time period? So the intervention that was provided for this project was stage 1 of implementation, provided a company-wide education about the purpose and components of the project. This was completed using handouts with key points that were highlighted. A specialized training was provided to scribes explaining how to conduct and chart the results of the audit screening in the patient medical record. Stage 2 of implementation was implementing the audit tool as part of the standard patient workup at all adult patient visits. Stage 3, the scribes took the screening tool and asked every adult patient the series of questions at the beginning of each visit with the provider. The scribe then relayed the scores that were collected from the audit to the provider, and they addressed the concerns, if they had any, with the patient during the appointment and the possible treatment options. The outcome and time frame was at the end of the 8-week period given for the project. There were 763 adult patients seen in the clinic. Out of those seen, 474 audits were conducted. This facility is at a 62% audit completion rate for the 8-week time period. There is significant data to show that the effectiveness of this questionnaire when used during patient appointments can be positive. Results from the post-project survey revealed that staff were satisfied with the process. 6 employees were asked to complete the survey. Of those 6 individuals that participated, 2 completed the post-project survey, possibly resulting in skewed results. Evidence to support the project. There was a literature review that had been conducted to determine the expected benefit of utilizing the audit questionnaire in place of the cage questionnaire with adult patients in the primary care setting. Alcohol use disorder is a common disorder in the United States. The 12-month prevalence of alcohol use disorder is estimated to be at 8.5 among adults ages 18 years and older in the United States. Rates of the disorder are greater among adult men at 12.4% than among adult women at 4.9%. 12-month prevalence of alcohol use disorder among adults decrease in middle age, being greatest among individuals 18 to 29 years old at 16.2%, and the lowest among individuals ages 65 years and older at 1.5%. The 12-month prevalence varies markedly across race, ethnic subgroups of the United States population. Both the CAGE and the audit questionnaires are useful tools to aid in the early detection of alcohol use disorder. The audit questionnaire is a more detailed questionnaire compared to the CAGE. The evidence-based practice model that was used for this project was the Iowa model of evidence-based practice. For this project, the evidence-based practice model was chosen. The Iowa model of evidence-based practice was chosen because it seems to flow well from each stage with step-by-step instructions and has been proven to be a successful model to use in implementation of evidence-based projects. One aspect that was appreciated with the model is the model periodically pauses and asks the user a question, ensuring you are still on the right track with the project. This was beneficial in that if you, at some point during the project, thought that there was not enough evidence and the change is not appropriate, it was known prior to conducting the entire project and it was possible to reevaluate and switch directions. This model was the perfect driving force for this project due to the specific procedures that made it successful. First, it was necessary to connect with the clinicians, organizational leaders, key stakeholders, and staff, as well as build an organizational system support. It was important that an awareness was created to pique the interest of those that would be impacted by the results of this project. Members that would be impacted included the project with this project were members that sat on the quality control board, leadership board, staff, and many members of the businesses and community. Next, building the knowledge of those involved directly and indirectly with this project in the part of the project education was being conducted. It was important to educate those involved with the implementation of the change to ensure they understood the reasons for the change and the direction to conduct such changes properly. Education was offered to the patients, to all of the patients, the implementation of the project would impact. Making the impact observable to those involved was beneficial when making permanent changes at the end of the project. Teamwork, troubleshooting, and action plan was an important part of this project. Allowing staff to help with the troubleshooting and asking their opinions about the use of the audit questionnaire allowed them the opportunity to voice their concerns or ask questions. Third in this process was promoting the practice. This means reminding the scribes that we were implementing the audit questionnaire to use the tool for all adult patients. They utilized emergency medical records, or the EMR, documenting the results of the questionnaire in the patient's charts. The last stage of the Iowa model evidence-based practice was to integrate and sustain the use of the audit questionnaire. This was completed by keeping track of the percentage of audit questionnaires that were conducted and offered to answer any additional questions or concerns by staff, patients, or leadership. Here you can see in the next two slides that we reveal the results. At the end of the 8-week period, you can see we had a total of 736 adult patients seen, and of those, 474 audits were conducted. This just reviews, as previously stated earlier, the percentage of completion of the audits compared to patients were 62%. And here breaks down week to week on the patient seen versus the audit questionnaire conducted. Clinical practice implications and recommendations. Responses from employees, participants, reiterates the effectiveness of using the audit tool as opposed to the CAGE questionnaire. The biggest restraint on the project was scribes forgetting to utilize the tool while conducting adult patient appointments. If the use of the audit questionnaire is desired in the future, it would be beneficial to have a designated person to conduct occasional chart reviews to ensure they are being completed. Project design and implementation. The project was sent to the Briarcliff IRB board for review prior to implementation. Approval was also obtained by the Department Director of Nursing and Leadership Department at Season Center Behavioral Health. Audit questionnaires were conducted over 8 weeks, October 2020 through November 2020. Audit screenings were tracked in the electronic medical record by the scribe completing the visit. Once completed, it was the responsibility of the primary researcher to count the number of adult patients seen and the number of total audit questionnaires completed daily. And the next 2 slides will go over the nursing theory that was used for this project. And this is Dorothy Oram. Oram's conceptual model was the nursing model that was chosen as being most relevant to this project. In Oram's model, there are 3 key concepts that are included: self-care, self-care deficit, and nursing system. These are 3 key qualities that the project chosen was based around. It was important to remember that when implementing different screening tools for patients to detect disorders, these 3 concepts were part of the considerations. Was the patient caring for themselves? Was there a self-care deficit when choosing to partake in alcohol or other substances? Was the provider competent in recognizing when the patient was making choices that could be categorized as a disorder? This model and system of theories specifically work together with the provider actions in relation to the patient's capability of self-care and decision-making. The relationship to my project is it relates due to wanting to educate the patients on the best decisions for themselves in order to promote the best self-care possible throughout their lives. Thank you for joining me today.